You having trouble with bunions? Do they cause your feet to hurt often? Have you put off having something done about your bunions because of horror stories of long, painful recoveries? Well, wait no more. Dr. Neal Frankel, a board-certified podiatrist and surgeon, has brought the amazing Swiss technique to Chicagoland. This nearly painless, short recovery procedure has been called a miracle by his patients. Let's hear what else they have to say.
I've been in pain a majority of my life. I grew up dancing, and my left foot especially has given me some trouble. Because of the foot pain, I had to avoid running, and also I was a dance teacher, and there were times where I wasn't able to show the students a certain step. I'd seen other doctors that just talked about longer recovery times and just more invasive surgery, and I just would have rather dealt with the pain than gone through with that. I found out about Dr. Frankel's Swiss technique actually through his website, and then later on through my first initial appointment with him. He was able to go into greater depth about the technique, and it just sounded like a technique that would work for me. I had a lot of motivation to have the surgery by Dr. Frankel. I was starting my training for the Chicago Marathon and just hit a stumbling block. I knew that my foot was just not going to allow me to continue unless something was changed and done about it. I was excited that it had such a shorter recovery time, it was less invasive, and just really sounded like it was too good to be true.
I grew up as an elite athlete, playing volleyball, basketball, and I've experienced foot pain. You ignore it, that's what you do. Eventually, now dancing with my husband at a wedding, I was in so much pain I had to stop. At that point, I had to make a change. And I felt embarrassed, and I decided if things are affecting me on my daily basis, then I need to go and take care of them. So that's when my primary care physician suggested to go to Dr. Neal Frankel and to have surgery done, or at least inquire about it.
Your Achilles are really tight.
The turnaround time was very quick. I didn't quite believe it at first, but as his gentle demeanor, he explained things very clearly and professionally.
Well, I've been practicing for 30 years. I grew up in Chicago. I trained here. I learned traditional open surgery, that type of surgery that pretty much most doctors will do. I also was trained and board certified in minimal incision surgery, surgery using less invasive type incision. Traditional surgery that's being done by most doctors involves making an incision on the top of the foot, probably about this long. Essentially what happens, they cut the bone, they then will go ahead and put screws and pins, and they may be actually a recovery time of at least 6 to 8 weeks. What I did is I basically made a smaller incision under here, only about maybe 1.5 inches. That way it also stays away from all the arteries and nerves and veins that's up here, so you don't get as much swelling. Then by using a smaller incision here and a laparoscopic approach to put a little screw through a pinhole up here, the patient can walk right away, and they don't have the traditional swelling that you would see with regular surgery. So not only could they get back into a shoe in a very little time, but they could actually do their activities at hard impact in less time. If we look at what we call normal foot anatomy, what you would see is all the metatarsal bones sitting next to each other, all in straight alignment, and the toes actually sitting in that same alignment. When a patient presents a bunion deformity, which is mostly hereditary, what you will see as compared to a normal foot is the bunion is actually the metatarsal bone, which is shifted out of position. The metatarsal bone moves inward, and thus the big toe moves toward the other toes. This causes also what's called a hammer toe, where the toes will be contracted. Over time, as this continues to move out, then you start seeing more arthritic changes and what we call degenerative joint disease. This is a close-up of what we call a normal joint, and you can see the alignment where the big toe is straight on the metatarsal, and there's cartilage in every joint, and normally when the toe is in a straight line, there is no wear and tear on the cartilage. When a patient has a bunion deformity for a period of time, because the toe is sitting in a crooked position, they get what you call degenerative joint disease, or a type of arthritis. And it occurs because of uneven wear in the joint itself. You get different stages of this. It starts out with cartilage erosion, which is an eroding of the cartilage. You get what's called osteophytes, which are spurs or calcium deposits which occur in the joint. And then you get what's called joint narrowing, where the joint itself becomes stiffer because you're losing the cartilage. When you get to a stage 3, if this is not corrected, then it becomes what we call full thickness erosion, which is, another term is bone on bone. When this happens, the pain becomes much more severe and the limitation of motion is greater. We tell patients that they should have the problem corrected when they're at an earlier stage, rather than waiting till a more severe stage where the procedure is not as effective and may even require an artificial joint or a fusion of the toe. When you look at this x-ray of a bunion deformity, you can see the big space between the metatarsal bones. You can see how the big toe is leaning over toward the second toe and the bump sticking out from the foot out of alignment. If you look at the after x-ray, you can see how the metatarsals are now sitting in a straight line, the toes are in a straight line, and you can see the small screw that I put in to hold the bones in place. The micro-Swiss technique is performed using a local anesthetic with a mild sedation, like a twilight. It doesn't use a general anesthetic. The procedure takes me about 35 to 40 minutes. It's outpatient, and the patient can walk immediately after surgery. I also specialize in some newer innovative procedures for runners and athletes, people who stand on their feet. There's something called shockwave therapy. It uses actually a pulse ultrasound. And it's been used by all the major sports teams. It's used by marathon runners. It is a procedure where it uses sound wave. And you can continue your activity. There's no anesthetic. People who have heel pain can have it and not have injections. What it does is it breaks down the damaged tissue and regenerates new healthy tissue without surgery. So it's been fantastic for people who are very active and want to continue with their activity and does not require actual surgery.
I had this goal to finish the Chicago Marathon this year. I was running for reasons that were very important to me. I was running for my best friend's foundation. So I was very motivated to see Dr. Frankel and to have the surgery done, because that is ultimately what allowed me to accomplish the goal and to finish that darn marathon and to see it through.
He was the most gentle doctor, very experienced, very professional. It showed me the micro-Swiss technique, and I was sold. I wanted the surgery that day. In fact, that week I had my right foot done, and then it went so well. 10 days later, I had my left foot done. Look, I'm standing here without anything on my feet.
The exam with Dr. Frankel went very well. He just felt very confident in his experience with this type of surgery, and he was able to answer all of my questions and just make me feel very comfortable with the surgery, and I really feel that he was the best person for this job.
What I found is after the procedure is done and patients are able to get back to their regular activities, the pain that they had before the surgery is gone. They have very little to no pain during the post-op period, but then when they get back to their activities, there is no pain. The pain that they had before is gone.
Feeling pretty good. Only 8 more. My feet are doing well.
After the surgery, I had absolutely no pain. I was in complete shock about that, as I expected that there would be some pain, and I'm able to get back to high impact aerobics, running, swimming, pretty much anything that I want to do without pain.
I was very surprised. After surgery, there was no pain, no discomfort. I only had to take medication for 1 day. In fact, when I had my other foot done 10 days later, I had an event to put on, and sorry, Dr. Frankel, but I worked the same day that my surgery happened, and I was fine. Everyone was so amazed that I had surgery that same day.
This procedure has meant the absolute world to me. I'm able to go back to running, I'm able to dance and pretty much just do any activity that I'd want to do. And I think the biggest difference is that I have no foot pain because of it.
My feet feel fantastic, very pain-free, finally at last, since I've been waiting since I've been in high school to be pain-free. And now, my husband and I went out dancing last night, and it's fantastic.
Many patients have put having treatment off in the past. Fear of pain, fear of being laid up, and there's no reason to put it off anymore. Technology is such that we can get patients on their feet with minimal complications and minimal pain and discomfort.
Thanks, Dr. Frankel. Couldn't have done it without you. Thank you.
Dr. Frankel's expertise does not end with bunions. He is also a leader in the treatment of heel pain, flat feet, plantar warts, sports injuries, joint replacement, and pediatric and juvenile deformities. Whatever your foot issue, Dr. Frankel may be able to help. Call Dr. Frankel now at 312-372-3117 or visit afootandanklecenter.com.